Hello everyone, my name is Dr. Joel Rosen. I am a thyroid recovery expert, and today I want to talk to you about thyroid problems in women. If you search the internet and you look at all the statistics on thyroid problems, you'll see that the majority of sufferers are women. You'll also see that there's more than 10 million Americans that at any one time suffer with a thyroid problem, predominantly hypothyroid. And so these are symptoms like gaining weight no matter how much exercise you do or how much food you eat or you don't eat, not being able to sleep properly, always feeling exhausted, crashing in the middle of the day, feeling cold, losing hair, combing your hair and it's all coming out on your brush, having brain fog, so you're not remembering where you put your car when you come out of the mall, or being in the middle of a phone conversation and forget who you're calling, or having gastrointestinal problems, bloating, constipation, diarrhea, sensitivities to certain foods, dryness of your skin, just not living the life that you want. And so let's talk about normal thyroid metabolism, because I think that's really important for people to know, because what happens, this is what typically happens, is you'll go to the doctor, you tell them that you're not able to lose weight, or you're cold, or you can't focus, or you're depressed, or you have gut problems. They'll run a test, they'll really do only TSH, and the chances are your TSH levels may be normal. And if they're normal, then does that mean you're necessarily normal? Like, why are you feeling crappy when your blood tests are normal? How does that make sense? Let's talk about the normal thyroid metabolism. So basically, you have the hypothalamus. The hypothalamus is the central control station of your brain, and it senses the environment of your body, and then it makes changes accordingly by releasing hormones that tell your glands what to do. The thyroid is basically in charge of your metabolism, so there's a receptor for thyroid hormone on almost every cell in the body, and so that will help the cell produce energy. And so what happens is, let's say you're cold, you go to a restaurant, it's really cold, or you go outside and it's super cold, or your house is cold, and your body needs to warm up. What will happen is it will release thyroid releasing hormone to the pituitary. And the pituitary is the obedient sergeant that notices changes in the body from the hypothalamus, telling it to have to release some additional hormones. So what this does is the pituitary releases TSH, which is called thyroid stimulating hormone. And that's what most people are familiar with. They know that they got tested, their TSH got tested, it was normal, their TSH got tested, it was high, or their TSH got tested and it was low. And by the way, when you're just basing your thyroid levels on TSH levels alone, then that's an older than 50-year model of making a conclusive decision about your thyroid health. The problem is there's a lot of reasons why TSH can go low. It's not just hyperthyroid, or there's a lot of reasons why your TSH will be normal when it's not. And so that's why it's really important to look at the other hormones. So what happens is TSH goes to the thyroid and it says, okay, hey thyroid gland, you got to speed up your metabolism. It's cold in here. You got to warm it up. You got to turn on the furnace, put some logs in the fire, and get this body warmer. What happens is the thyroid will produce 93% T4 and 7% T3. 93% of the hormone that the thyroid makes is not actually available for use. It's unavailable. It's inactive. And only 7% of it is actually active. And so what that means is you have coffee beans and you have ground up coffee. And the ground up coffee is put in the coffee machine to make the nice coffee. It's the same example of your thyroid hormone. You have T4, it's the coffee bean. T3 is the ground up form. So we have to convert T4 into T3. And so number one problem with thyroid measurements is we don't measure T4 and T3 a lot of the time. There's two areas that we want to measure. We want to measure the free T4, or the one that's available for use, that's not bound to a protein. And then you want to measure the total T4, which is how much is bound and how much is unbound. And same thing for T3. And many times when I work with a patient, they only see TSH. So we don't have any quantitative information on how T4 and T3 is. Number two, thyroid must be converted. So we have coffee grinders in our body, and 60% of the hormone being converted to T3 takes place in the liver. And so what happens if the liver is under stress? What happens if your blood sugars are unstable, you may be pre-diabetic or hypoglycemic or diabetic? Then we know there's going to be some liver issues, because that's where glucose is converted and stored and manufactured. And so if the thyroid's not, or let's say you're toxic, let's say you have an infection, you have a bacteria infection, or let's say you have a virus, or let's say you have a heavy metal or a parasite or a fungus or a mold or some kind of mycotoxin. Let's face it, we all live in an environment that's not the best, and there's a lot of toxic exposures, and our liver is under a lot of stress to detoxify. It's also under a lot of stress to maintain blood sugar and produce hormones. It's also under stress to convert T4 into T3. So if you never measure your liver values, or your T4 and T3, or your total T4 and your total T3, you're not doing a complete evaluation. The other places that hormones get converted is in the gut. So 20% of the hormone that your inactive hormone gets converted into your active hormone is in your gut. So let's say you do have inflammation in your gut. You're not digesting your foods as optimally. You're not secreting as much stomach acid to break down the protein, and which happens as we get older because we've been eating processed cooked food over the years. Or you're not secreting enough digestive enzymes because the pancreas and the gallbladder and the bile formation is not as effective. Then that food just sits there. And when that food sits there, it doesn't get digested. We get gastric reflux, and we also get burning and indigestion, and then we start to develop leakiness of the gut, intestinal permeability, food sensitivities, and basically you're not converting T4 into T3. It also takes place in the peripheral tissues, so that means in every other tissue besides your gut and your liver. And so if the tissues are inflamed and there's a lot of decreased activity of those tissues, then you're not going to convert T4 into T3 very well. So the other thing that's very important to know is, like I mentioned earlier, 80% of the thyroid problems are a result of an autoimmunity. So that means your own immune system is starting to attack your tissues. And when it's a thyroid problem like Hashimoto's, it's attacking your actual thyroid gland. And so what you need to have tested is you need to have your TPO antibodies and your thyroid binding globulin. And if you don't have those two antibodies tested, there's no way of knowing whether or not you have a thyroid autoimmunity called Hashimoto's. If you do, which majority of the patients that I work with that have never had their antibodies tested get tested and find out, sure enough, they're positive, then you have a whole other problem to deal with. It's not a fact that you have too little thyroid stimulating hormone. You don't need TSH. You don't need thyroid armor or T4 or T3. You may need T4 or T3, but the bottom line is your immune system is going out of control. You need to address your immune problems. And there's a lot of supplements on the market like turmeric, resveratrol, glutathione, vitamin D, nitric oxide. There's a lot of different supplements on the market that are very, very good, but you need to be worked up properly. And that means you need to ask for total T4, total T3, reverse T3, free T3, free T4, free thyroxine index, TSH, TPO antibodies, and thyroid binding globulin antibodies. That's a complete thyroid test. If you have those tested and you find that you have an autoimmunity, now you have a whole other problem. When you have a whole other problem like an autoimmunity, it's time to address these through gut repair, through inflammation control, through liver detoxification, and other detoxifications like infrared, coffee enemas, avoidance of certain foods. So there's a lot of things that you can do besides just going on TSH. So hopefully you found this lesson very, very important, very valuable. A couple light bulbs went off in your head. Maybe you're even a little mad because you've been on thyroid stimulating hormone for years and years and no one's ever told you about this. I've had a patient who was in her 70s on this medication for 15 years, and we did a TPO antibody test and her results were in the 1500s, and it shouldn't be be above 34. And she was really mad, and what we did is we decided to do a gut repair protocol. We did a liver detox. We reduced immune stress on her body. We also removed the foods that she was reacting to, and we saw those slowly come down. Now, she still needs to be on thyroid meds because she's been on them long enough that her thyroid basically has been castrated chemically, if you will, and it is no longer able to produce its own hormones in its body. I say it's like a domesticated animal that you can't put into the wilderness and it will fight for itself. But the thing is we can certainly bring down the inflammation, bring down the antibodies to her thyroid, and get her functioning properly. So hopefully, again, you found this very, very informative. My name is Dr. Joel Rosen, and I hope you get some relief in your thyroid problem. Thank you so much.